Acne is a very common concern and we see quite a lot of patients presenting with this condition and it's not limited to teenagers alone. In fact, over half of our patients who attend this clinic are aged between 30 and 45. We have a range of treatment options for acne, and after a thorough medical consultation and confirmation of the diagnosis, firstly we would commence the person on a cosmeceutical regime, which is essentially medical grade products that they take home with them and use for at least 6 weeks. And then we would review them to see how they're getting on, because I do find that often, especially in mild to moderate cases, that regime alone delivers the required improvements and you don't need to move on to in-clinic treatments. If at that point there aren't the desired improvements, then we can continue that regime whilst commencing in-clinic treatments. All too often, acne sufferers have overdone it with anti-acne treatments, which can often have quite harsh ingredients and chemicals. So it's understandable that they've tried everything they can to deal with their spots, but what they've done is actually created more imbalance, irritation and dryness, which just actually encourages more spots to be produced. So there are two aims to our cosmeceutical treatment plan. One is to soothe the skin, so really want to deliver soothing anti-inflammatory ingredients rather than anti-acne ingredients per se. And one of our favourites is actually something from our organic line, which has medical grade results still, but what that does is deliver soothing agents without having all these other auxiliary ingredients and chemicals which can actually just make the problem worse. And then the second aim is to deliver anti-acne ingredients, but in an appropriate strength and at the right frequency, so that you are working against the spots and also discouraging new spots to develop, but at the same time not aggravating the skin and making the problem worse. Now, many acne sufferers will have oily skin, not all, but many will. And this can lead to the perception that the skin does not need hydration, but actually the opposite is usually true. When the skin is dehydrated and dry and lacking moisture, the sebaceous glands, which produce natural oils that come onto the skin, can actually go into overdrive trying to compensate, and then you can get this oiliness as a result of that. But what that skin still needs is moisture. The key thing there is that a lot of moisturisers will have oils in them that will actually clog up the pilosebaceous unit, which is where the hair goes into the skin and where the glands are. So careful selection of moisturisers in acne-prone skin is very, very important to make sure that, again, you hydrate the skin appropriately without aggravating the acne. Probably our most successful treatment protocol for acne is combining peels with mesotherapy. Skin peels or chemical peels involve administering a mix of acids onto the skin to essentially exfoliate and clear out the skin, and in particular something called the PSU, pilosebaceous unit. And this is where the hair follicle and sebaceous gland live and where spots originate. And mesotherapy is a wonderful treatment, over 60 years old now, which involves administering proven and effective medical grade ingredients that we know work, but rather than applying them to the surface of the skin, we're administering them directly into the skin, thereby bypassing the skin's natural barrier effect. So how do we administer that to the skin? We use a motorised delivery device, which is very precise and accurate and fast, and the advantage of that is that the patient suffers no pain, patients find it very comfortable and a tolerable treatment, and the results are usually immediate with no downtime.